I'm Dr. Edmund Sulkowski, and welcome to another edition of Healthy Pets, Healthy Owners. Our topic today, healthcare reform, a free market and free market medicine. That's a term I'm sure that you've not heard before, but we're going to talk about it in depth with my guest today, Mr. Tom Yakopin and Dr. Kirsten Lynn, MD. I got that name right.
Yes,
we were
did.
joking before
Yes,
that I was going to mispronounce it, but we didn't do that. But I'd like to welcome you both. Tom's been on the show a number of times before, and we know that Tom is the director of the West Penn Life and Health.
Yes.
And he's talked a number of times about the alternatives out there to traditional health care insurance.
Correct.
And we've also talked about how health care insurance is not health care, it's insurance.
Right on.
And so we're gonna hit on that topic again today.
Good.
And then Dr. Lynn was kind enough to come in today because she has a practice that kind of works hand in hand with this new philosophy that's changing, I think, medicine and maybe even the future of how medicine is handled with even insurance and without insurance.
Exactly.
So we're going to go into depth of that as well. So thank you both for taking the time out of your busy schedule to come on Healthy Pets, Healthy Owners. So Tom, I've known you, I think, 3 years, two and a half, somewhere in there?
Yeah.
And we were talking right before the show started how my personal experience with an emergency and a surgery and my new policy that I got with West Penn Life and Health that you wrote for me really kind of saved the day because it intervened and covered the cost after my deductible. And we're going to talk on Healthy Pets, Healthy People on AM 1250 here coming up on the 19th, I believe it is, of October. A little more about that because I think it's important for everybody to know. But what do you offer with West Penn Life and Health as far as health insurance?
Yeah, our agency is like any agency, that you might bump into on one hand, in that we sell life, health, Medicare, retirement planning, but my specialty and my calling, I think, is doing things a little differently. Since the passage of the Affordable Care Act, I've noticed that, in particular, the working middle class is struggling paying for traditional major medical premiums. And that got me looking. And so, and I was one of those people, by the way. My premium shot through the roof, my deductible was high, I didn't like anything about it, and I just thought there has to be something better,
Yeah, it was a wrong name, the Affordable Care Act, because mine went almost triple, and I couldn't afford it. It was a mortgage payment.
It was, yeah, and when you see the stress that it puts on many of the clients that call our office or come in our office, it's heartbreaking. And what else? And what we did was we began to ask better questions and get better answers, learning about alternatives to traditional major medical, such as Christian sharing ministries, such as indemnity insurance or skinnier hospital surgical plans. But it also led me to learn about free market medicine, which is where I bumped into the FMMA, Dr. Keith Smith, the Oklahoma Surgery Center, Dr. Kirsten Lynn, and these are the people that are really from the ground up, from a grassroots, upward rather than government downward. These are the people that are reinventing healthcare, and that's what we do differently, Doc.
So you basically reinvented health insurance with what you're offering.
Yes.
And Dr. Lynn here has reinvented practice.
Yes, healthcare.
Actual health care.
That's right.
And so you're a Family Matters Direct Primary Care Physician.
Correct.
And you're located in Ellison Park.
Yes.
So what do you do in your practice that is different?
Well, I had practiced in the traditional health system for 12 years coming out of residency, and what I found there was 5-minute appointments, a difficult time taking great care of patients. And so, like Tom, I was looking for alternative models of healthcare as well, so that I could escape this sort of hamster wheel that I was on. And I came upon the direct primary care model of health. And what I found with that, it's subscription based. People refer to it as the Netflix of healthcare. And it works really well because it allows for longer appointment times and personalized care with the patients, and so it's good for doctors, good for patients.
In a general practice that's most likely owned by a hospital or a group of physicians or an insurance company and so forth, you have actually quotas that physicians have to meet, see so many patients within a given set of time.
Absolutely.
And so it becomes very difficult, I would think, to really assess a patient's issues in their health.
Sure. Back in the health system, I was asked to see 25 patients a day, and I was skipping lunch. The patients had 5 minutes to see me. The waiting rooms were packed, and if somebody had more than one issue they needed to discuss, we would have to reschedule them, and then they wouldn't be able to see me again until maybe 5 months later.
And so you see a patient twice a year for 5 minutes each time,
right.
And then you're prescribing health care, which makes it difficult on you and on the patient.
Exactly.
And the quality of health care goes down, and your practice is now able to change that because you're in charge.
Right, yeah. This direct care model really restores the physician autonomy and my ability to work with the patient together and come up with a treatment plan that's doable.
So the culmination is actually, I think, the future, because the way things are going, it's not looking good if you look at the traditional health plans and so forth.
Correct. We were just joking on the way in, about kind of what led me to do what I do today. And I was saying that a wise man is quoted as saying a definition of insanity is doing the same thing over and over, expecting different results. And what you have in health insurance and the price of health care, because let's face it, the cost of care has gone up significantly over the last 20 to 30 years. And when I say that, we know that a pacemaker that can be purchased for at or about $10,000 might often be billed to an insurance company for $100,000. Why? Because nobody's asking the question, what does this cost? And what's happened with the insurance insertion between the physician or provider, and I don't like to use that word because, but you get the point, the health care giver and the consumer, the insurance model is inserted in between. And number one, that doesn't have to be so, and I think it shouldn't be so. But as a result of everybody relying on this third party, the only thing consumers seem to be worried about often is what's my copay or my deductible. They're not asking simple questions like, what is this CAT scan going to cost? So it's driving healthcare through the roof, the costs, and the cost of premium are going through the roof. And we're seeing that, number one, it does not have to be that way. Number two, there are better alternatives. An example, we were talking about the CEO of Philadelphia American, who is an actuarial scientist, a very brilliant man, but he loves studying medicine and so forth. We believe that something that is important to consider is the physician-patient relationship is a very important, it's like the first line of defense to mitigate risk down the road for significant ailments and illnesses. And what's happening in the corporate model, which Dr. Lynn used to be under, and my physician, Dr. Rebecca Plute in Canonsburg, I don't use you because you're an hour away, but I would otherwise. But they're both doing the same thing. But the thing is that the physician-patient relationship, I see the same doctor all the time. I can text her. I can send a picture. I get immediate results. So you have a long-term relationship with a physician that knows you, and a physician that's not really working for the insurance company. The physician is doing what he or she went to school to do, and they're doing what they see fit. Does that make sense?
What you're defining actually is the difference between health insurance and health
Thank
care.
you. Yeah.
There's a big confusion out there that health care is insurance, and it's not.
It's
that.
not.
And also what you're really saying, and what you both are saying, is a proactive approach as opposed to a reactive approach to medicine.
Right.
And that's critical. So, Tom, you're also a spokesman for the Pennsylvania chapter of the Free Market Medical Association. Explain a little bit about what that is.
Yeah, so the Free Market Medical Association, and I love to put a plug in for them. People can learn about them online at www.fmma.org, is a national association of like-minded individuals from many walks of life, many of them physicians. One of the founding members, Dr. Keith Smith, is an anesthesiologist and founding member of the Surgery Center of Oklahoma. But these are all people like Dr. Lynn, like Dr. Plute, and many others who just saw that health care was going in the wrong direction. It had been hijacked by corporate interests, including insurance companies, PBMs, and many other things. And they decided that they didn't want to do business like that anymore. And Dr. Smith in particular has a very successful surgery center, and they are incorporating a narrative that I believe is important to the American people, and that narrative is price honesty and price transparency, something that is missing in healthcare. I mean, if you think about it, only in healthcare do you go shop off the menu, right, and receive products or services without really knowing the price of them in the traditional corporate model.
That's absolutely true.
Okay, and that's part of the problem. And Keith is changing that. And the FMMA was designed to help other physicians and other practitioners of medicine to migrate from the corporate model to the new model successfully.
So you mentioned this term free market in healthcare. Would you both explain that?
Sure, sure.
Because you're taking, we have two different approaches here. We have a physician that's looking at this model, and then we have an insurance provider looking at this model.
Right, right. So, you know, we've lost the free market in healthcare in this country mainly because we're paying for services utilizing a third-party payer, you know, otherwise known as insurance provider or a government-run insurance program. And so what happens is people have no idea what the cost is of the services that they are receiving. And so a free market system takes the third party out of the system or utilizes them in a better way, such that patients are now empowered to say, okay, what is the cost of this service? And what is the cost of the same service at another health system? So now I can compare, and as long as the quality of the services are the same, I can choose the lower price option and save money that way. So.
And that's a whole new concept.
Whole new concept.
Can you add to that?
Yeah, certainly. I think it's a travesty, and I am certain that there are people watching this show who don't realize that you can go and seek health care without health insurance. I mean, I've literally talked with people that are like, I have to get insurance because I need to see so-and-so. I'm like, has it ever dawned on you, you really don't need insurance to seek help from a physician, right? But the model, oftentimes, in fact, recently I called a traditional dermatologist office, and the first question that I got on the phone, almost other than what's your name, is who's your insurance with?
Absolutely.
Right.
You know, it never used to be that way 20 or 30 years ago. So free market medicine, number one, is teaching people, you know, when you don't have prices for products and services, you do not have a market, period, end of story. And so that is curiously missing in the corporate model that we have had foisted upon us. So the FMMA and direct primary care physicians such as Dr. Kirsten Lynn and Family Matters in Allison Park, what they're doing is they're doing things transparently and honestly, meaning you pay a subscription fee, which is reasonable and low. You have no co-pays. You have no deductibles because there's no insurance. It's you, the patient, and your physician and his or her practice, and you're paying cash for services, including, and she can elaborate on this, including things like various types of tests and blood draws, where people would be shocked, pleasantly shocked, to realize how inexpensive these things can be when you cut out the middleman.
So in this free market approach, you're actually getting better service for less money.
Yes.
Exactly.
So it's a win-win for everybody.
Absolutely.
Absolutely
Yeah.
is.
So that's one of the major ways that this free market approach is improving healthcare.
Yes.
Yes. Uh-huh.
Is it hurting the insurance agents, the insurance companies?
You know, I don't think the big box insurance companies like it. You know, they've created a model that is very lucrative for themselves and the systems that they are propping up. So this is kind of bringing much needed disruption to the market, and regardless of what they think about it, consumers are winning. An example, just the other day, I had a need. I was at dinner with Melissa, one of our favorite restaurants in Washington, and I had to call my physician because of a particular flare-up, and I texted Rebecca, and within about 7 minutes, I get a call at the dinner table. What's up? I gave her my symptoms, which I've dealt with in the past. She said, I need to get you on this medication. Now I'm going to call Jeffries down in Canonsburg. Can you pick it up by 7? I said, I can't because it's 20, you know. But at any rate, with a text, a phone call to my physician, and within 40 minutes, my prescription was delivered to my house because of direct primary care, of a caring physician who is doing what she went to school to do, a local pharmacy who went out of their way to make sure I got my prescription.
Jeffries is the best.
You know, and I got to tell you, people, even my girlfriend is like, this is unbelievable. You got to tell this story. I'm like, I do tell this story.
Yeah,
And Dr. Flute did this without you even making a trip to the office because she knows you, because she works with you.
Relationship.
Yeah, absolutely.
We've dealt with this before.
And that makes the difference, doesn't it, Dr.
Oh,
Lynn?
absolutely. I mean, we see so much fragmentation of care, right? A patient calls to see their PCP. The PCP isn't available for 6 months. Oh, you can see another provider here. You can go to urgent care. You know, that kind of thing doesn't happen in direct primary care.
Or go to a nurse practitioner. You're pawned off because you can't get in to see the physician.
Right.
And, you know, as qualified as they are, they're not physicians.
Exactly, and they don't know my patient the way that I know my patient.
Right.
So it's so much easier for me to handle something on a weekend via text than for the patient to drive an extra trip to urgent care, see a provider that doesn't know them, reinvent the wheel, spend money.
And then recommend seeing your family physician.
Correct, yeah. It ends up back in the same place anyway.
So there's a lot of talk in the country about health care reform. What does that really mean to us?
Well, I think unfortunately, the healthcare reform that has been going on thus far has not addressed many of the issues. You know, certainly the Affordable Care Act increased access to health insurance, but as you put it earlier, health insurance and health care are not the same things. And so we need to focus our energies on improving health care for people by making it more affordable, by creating more residency spots for more physicians to be trained and get out there in the workforce. So there are a lot of things. Another one is medical malpractice lawsuit tort reform that has not been addressed. And we see a lot of physicians ordering unnecessary expensive testing for fear of lawsuits.
And that happens every day.
All the time. And Pennsylvania is one of the worst states for that. And again, that has not been addressed at a federal level whatsoever with healthcare reform, and it might be the number 1 or number 2 reason for inflation of healthcare costs in our country.
You know, I think that what we call Obamacare did provide the availability of insurance for a certain group of people, but at the opposite end, like I think it did for Tom and it did for me, my policy was cut midterm, said you no longer have it, and then this is the replacement policy, and it was 3 times what the other one was.
Right, because with the Affordable Care Act, now you have people flooding the system who either hadn't sought health care previously and let things fester. You have people now with pre-existing conditions back into the health insurance realm, and so now the insurance companies have to compensate for that by increasing the premiums and deductibles to the point where, you know, very few people can afford this anymore.
And then if you have to see a specialist for anything, it's always that primary care referral that you need, which adds more costs.
Correct.
To getting the care that you absolutely need.
Right, and also the prior authorization process. You know, sometimes with the health insurers, you'll say, okay, this patient needs an MRI. And they'll come back and say, no, they need to see a physical therapist for 18 sessions before they have an MRI. Well, they end up doing the 18 sessions and having the MRI, so now you've maybe tripled the cost of that person's care for that episode.
Tom, do we actually have a free market in place right now?
No, it's a cartel. It's a shame. Like I said, you don't have a market unless or until people are educated and know what the price of things are and actually have a choice. And what you'll note, and again, I'm not going to mention names, but in Pittsburgh, you have two major insurance giants, one of which is both an insurance company and actually owns hospitals and kind of de facto owns doctors. So I don't know if consumers see maybe a little oddity to that, but it never used to be that way 30 years ago. Meaning what? Meaning 30 years ago, number one, we weren't insuring sniffles, hiccups, and nosebleeds. That is dumb. It doesn't make sense to, it's like insuring a light bulb in your home. Or an oil change with your car. By doing that and by mandating all of these benefits, in comprehensive major medical, it's driven the cost up. And then managed care, where you have the insurance companies actually calling the shots in many cases. What's covered, what isn't covered, in network, out of network, see this doctor, don't. That's all, it never used to be that way. A consumer was able to see the physician of his or her choice. The physician was able to make the decisions that they felt were prudent and best practice for the consumer based on their medical expertise. And the consumer bought insurance from a third party that indemnified them against the big stuff. And by the way, we didn't have to insure an X-ray 20 years ago because they were cheap. And by the way, when you buy an X-ray cash pay, what's an X-ray if I needed one, or a CAT scan and I were coming into your shop? What would it cost?
Well, the negotiated rates that we have with a local independent radiologist, you would be able to get an X-ray of any body part for $50 and a CT of any body part with or without contrast for $250.
Hello.
As opposed to the customary charge $5,000 to $7,000 for a CAT scan?
Right. And just as a personal story, I had to have an MRI of the brain a couple of years ago, and I contacted my health insurance company and said, what would be my out-of-pocket responsibility for this MRI? My out-of-pocket would have been about $1,400 for that test. So I called my friendly neighborhood radiologist and said, well, what is the cash price? The cash price was $500. So just in that one day, I saved $900.
For the same exact test?
Correct.
Same exact test.
And not only that, but because I know the radiologist, I am able to receive a disc with the images on there, plus the report, and that's all included in the $500.
See, Tom, I know I see myself as an educator. Tom, I know, sees himself as an educator as well. And you did a great job of educating me.
Thank you.
Because I went in for some blood work, and the actual total cost of the blood work prior to my knowledge was $5,000.
Oh my goodness.
So it didn't appear that way initially. The insurance company paid so much, and then I started getting bills from the physician that read the blood work, and did he really read it? It's a computer printout, so it goes within its parameters,
Yeah.
So he looked at it and said, okay, what, Anyway, so over a period of time, I'm getting these bills, which almost totaled $5,000.
Oh my goodness.
So when I needed to repeat that test because of Tom's education here, I went and asked, what is the cost of cash pay for this test? $700, $800 was the range for
everything.
And
Yeah.
I added some more stuff to it.
Right. Right.
And so it holds true when you're educated and you're aware of what's going on. There is a positive alternative that gives you good health care and saves you money at the same time.
Absolutely.
So why can't our government work that out?
Well, again, they're on the. I think there's a lot of people on the take. Okay, there's a lot of money being made with this scam. I forget the author that said this, but might have been Mark Twain said, it's easier to fool people than to convince people they've been fooled. Now, having said that, let me say this. There are times where consumers come into the office and they have the traditional medical plan, and they have a copay for this or a copay for that. And sometimes it's a $200 or $300 copay for a bone density test, for example. I remember picking up the phone with a customer in my office and saying, let's call your doctor who's going to do this bone density test. I want you to hear firsthand what the cash pay price for this is. I think it was like $88.
Right.
Her copay was $300. So what happens is, here's what people don't know. If you go in with a traditional major medical policy, as I understand this, and you identify as I have Shifting Sands of New Mexico or Cheese Whiz Mutual or whatever the company is, that provider's office is under contract to charge that consumer their contract rate. Yeah. Okay, now what is interesting is she would have paid $300 as a copayment for that bone density test that she learned at my desk would be cash pay $88. And she's paying $900 a month for the privilege of having this insurance.
It sounds bizarre.
It's bizarre.
Yeah.
And that is our message. Our mission is educating consumers. So go back to your question. Do we have a free market in medicine today? Absolutely not. Why? Because consumers don't know the truth. They're being lied to. They have been herded into a mentality through employer group arrangements, traditional group arrangements, you know, the big ads on TV. And I mean, let's face it, you go to the Pittsburgh airport and some of the major advertisers there happen to be health insurance or health care providers, right?
And pharmaceutical companies.
Yeah.
Right.
You know, and people become enamored with that, like this is the way. And what we're saying to them, it's a way, but it's not my way, and it's not the way.
You know, we're going to take a little break here, and when we come back, let's talk a little more about what direct healthcare is and get into the nitty-gritty and educate our listeners out here.
Great.
We'll be back at Healthy Pets, Healthy Owners with Mr. Tom Yakopin and Dr. Kirsten Lynn. Welcome back to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski, and we're here with Mr. Tom Yakopin and Dr. Kirsten Lynn, MD, talking about healthcare and health insurance and the difference of the two. Dr. Lynn, before we mentioned earlier about direct primary care, and you gave us a definition. Would you define that again for us and then go into greater detail on how that directly impacts us as patients?
Sure. Well, direct primary care is an up-and-coming model of healthcare that's based on a subscription model. So instead of paying a fee for service, you're paying usually a monthly fee to receive typically unlimited primary care services from your one physician. And the median monthly fee for direct primary care in this country right now is about $70 a month. So that amounts to somewhere between $800 and $900 a year, which is actually very affordable for most people if you consider that the average American spends maybe $250 a month on eating out or cell phone bills.
Just on coffee alone.
Coffee, Starbucks, right?
Exactly. Well, yeah, exactly.
So, if you prioritize healthcare, you find that a direct primary care arrangement is very, very affordable.
And what does that actually give the patient?
So the nice thing about direct primary care is that it gives the patient really unlimited access to their physician. So, if a patient needs an appointment today or tomorrow, they can almost always be accommodated. Patients are able to email physicians, are able to text their physician, as Tom was mentioning before, and the lines of communication are very easy and open.
And then so based on that conversation that you have, you then decide whether that patient needs to come into the office, or let's say somebody calls you with a rash and they take a picture, you can look at that picture and make a determination.
Exactly, and you can say, okay, based on that picture, I think this is what's going on, or based on that picture, I think we need to have you into the office and look a little bit more deeply at this condition.
So it's actually a more responsive way of treatment.
Sure. Yeah, because now instead of patients kind of calling a centralized scheduler and ending up on this sort of merry-go-round of different operators, they can contact me directly by calling the office or my cell phone or sending a text or email, and patients really love that.
You both had mentioned earlier that a lot of these practices are owned by hospitals, and you go through some central appointment scheduling. There's no direct communication right to your office. It's a centralized phone in, and you have to know a back door sort of to get in there, and you leave a message, we'll have the office call. Often that message doesn't even get sent to the office.
Yeah.
And
Yeah.
this way, you basically have one-on-one direct contact with your physician.
Right, right.
What do you like the most about it?
I love the autonomy to be able to practice medicine the way that I was trained and the way that I want to, and the way that I feel is of most value to the patient. When I worked back in the large healthcare system, I was told how to practice, usually by business people with no medical background whatsoever. Now I have the autonomy, and I'm able to really involve the patient in their care. And so it's really a win-win for doctor and patient, for sure.
And that's the reason you took years out of your life to go and be trained and be educated,
Right.
to provide this care for people, and that was kind of grasped and taken away from you.
It was. And actually, studies show that the lack of physician autonomy is the biggest driving force behind the epidemic of physician burnout and even physician suicide. And again, when you have a physician that's working in the health system on this hamster wheel, you have somebody that's usually not happy, probably isn't taking care of him or herself very well either, because that's hard to do, versus the direct primary care field where the physicians are happy and healthy themselves.
What do you feel the patients like most about it?
The patients like the time. I think time is the biggest commodity in healthcare. And the 5-minute appointment just doesn't cut it for one issue, let alone a patient who brings in a list of issues. So our appointment times are a minimum of 30 minutes, usually more like 60 minutes.
That's basically unheard of.
Yeah, you don't find that anywhere else other than a direct primary care arrangement. And our waiting room is about 10 feet by 10 feet. It's very small because we don't have people waiting in the waiting room. In the traditional system, people maybe have to take a day off of work just for a doctor's appointment because they have no idea how long they'll be there. But in my arrangement, they know the appointment's at 2. I'll be there from 2 to 3, and that's how I can arrange my day.
Tom, how does West Penn Life and Health and the services you provide interact with direct primary care?
Sure. Well, first of all, as a subscriber to a direct primary care physician, I have learned firsthand the value of what Dr. Lynn just described, and that is, I have direct access to my physician. I can have basically an appointment on demand. I feel like I have the best possible physician-patient relationship, and it's bringing good results in my world. So the first thing is I take that, when a consumer calls my office, they hear us on radio or see a print ad and they say, Mr. Yakopin, I'm paying $1,600 a month for a traditional major medical, we're unhappy. They don't come in, I'm not just pitching them a product. We're going to sit down kind of like you do, and I'm going to talk with these clients.
For an hour and a half, by the way.
I'm going to educate them. And I start this by saying, look, if you keep doing what you're doing, you're going to keep getting what you're getting. So we're different in that I'm not going to do that model anymore because I really don't believe in it. I think it's leading people in the wrong direction in many ways, okay? So our insurance, the plan that I promote, and I have a great relationship with the designers of the product and a lot of input. In fact, we just launched a brand new plan in PA called the Gold Plan. But what it is an indemnity approach to insurance. Meaning what? Meaning if somebody buys my health insurance product through Philadelphia American, they can see any doctor, any hospital, anywhere, anytime. We indemnify the consumer. I encourage the consumer to consider a relationship with a direct primary care physician. In fact, Family Matters brochures are in my office. Paragon Personal Health Care, Dr. Rebecca Plutz flyers are in my office. And I talk to them about considering asking better questions, doing things differently. Pay cash for the small stuff. Buy insurance for the big stuff.
So the product, and I will happily say I'm a client as well as
You
a
are.
friend. So, I firmly believe in what you're doing. You've helped me out tremendously
Yes.
in savings and still having quality health insurance. So you go in as a subscription, a patient goes into your practice as a subscription-based patient. So they're paying a monthly fee. Then there are some blood work and lab tests that you're going to order,
Right.
and so forth. That's where the insurance side of things kick in.
Yeah.
Yeah, it can, but
It
as
can.
Tom
They don't have to,
said,
though.
Primary care does not need to be insured because primary care, as a general rule, is very affordable for most.
Because you've worked out with different providers that are taking the blood work,
Right.
putting it in the lab, taking x-rays and so forth. You worked out prearranged pricing with them on a
Exactly.
cash basis.
Exactly. And so, a typical lab panel might cost a patient $25 to $30, self-pay, whereas if they had paid with their insurance coverage, probably their explanation of benefits will say, well, this cost $1,000. Luckily for you, we got it down to, $250. But the cost savings, if they had paid directly, would be tremendous.
Tremendous. And that is the thing. You don't when people see the prices that physicians can negotiate on their own cash pay, they'll come to the conclusion, I really don't need to insure that. Now, having said that, like for a CAT scan or an MRI, the consumer could go to Dr. Lin, be treated. Dr. Lin could write a prescription for a CT scan at her prices, which are, what did you say, about $250?
$250.
Okay.
Yep.
And with our product, in fact, the plan that you're on, with our product, you could then take that, you could pay cash for that, Doc, file the claim with Philadelphia American, and we would reimburse you a check typically equal to or greater than what you paid. And the reason that it works so well like that, and again, you don't have to indemnify the small stuff. but
Define
you
the word
can.
indemnify for our audience.
Indemnify, technically, insurance, the truest definition of insurance means that you pay a financial institution to write a contract that has a bucket of money that covers these various and sundry, anomalies or triggers: surgery, hospital stay, CAT scans, blood draws. Indemnify simply means that we write a check to you, the consumer, to keep you out of the weeds or to help you offset costs, okay? That's what insurance always did. And our plan simply gives the insured, the consumer, the autonomy to choose how they access care.
So what I'm hearing from both of you is I'm eligible for better health care at a lower cost.
Thank you.
Right.
That's the bottom line.
That's the bottom line, exactly.
Without taking on any more risk. And out of curiosity, how much did you save by getting rid of your old clunky model? What are your monthly savings?
Well, now this has been now a few years, but I was right about a little over $1,500 a month for my insurance policy, with a premium, with a deductible that went from $2,000 to $6,000.
Okay.
Right.
So what is that times 10? That's $17,000. That's $20,000 a year, Doc.
And when I talked to you and we sat down, and my first words out of my mouth was, Tom, I just want catastrophic care. And you said, well, that's what I have. And so our plans, I think, were identical.
Yes.
You said, this is, if it's good enough for you, it's good enough for me,
yes.
right? So my premium went from that almost $1,600 range to under $4,000.
Yeah. Yeah, and you have critical illness, which creates cash upon a diagnosis.
Explain that. That's
critical
kind of
illness.
unique.
Okay, so one of the challenges we see in healthcare is a critical illness would be heart attack, stroke, cancer, end-stage renal failure, whatever. Your plan has various components to it, especially for the self-employed. I look at this. So let's say, for example, God forbid, you did have a heart attack and wind up in the hospital. As you know, your Christian sharing ministry is going to pay 100% over $5,000. You have supplemental benefits from the ground up to help with other things. But on diagnosis of a serious ailment, the insurance company is going to write my consumer a check for $10,000, $20,000, $30,000, $40,000 or $50,000 cash. Okay, and I think we have you settled in at about 20 or 30,000. And the reason that I think that's an important component for the self-employed is we all know somebody that maybe has been diagnosed with cancer, God forbid, or a stroke. I had a friend that had a minor stroke, right? He was a speaker for a living. Half of his face was saggy, you know. For a couple of months, he couldn't work.
Yeah.
Well, you know, there's something called indirect medical cost, which means apart from hospitals, surgeons, doctors, anesthesiologists, radiologists, the mortgage still has to be paid.
Absolutely.
You know, and so your plan, our plan, typically includes critical illness, or we call it crisis recovery. Cash is king at claim time. Mm-hmm. Okay, so my client that has critical illness, in addition to their hospital surgical, is empowered with cash to take a moment. Like, visualize this: husband and wife get a bad diagnosis. You know, maybe it's a tragic diagnosis. Their world's collapsing. Mentally, they're stressed out. You know, and maybe that consumer's a small business owner. Life doesn't stop for them if they have car payments, or maybe he's a truck driver or a contractor, employees. On diagnosis, one of the first things that might happen for that client is they get a $50,000 check. Okay, what's that going to do? That's going to empower them to take a breath. That's going to empower them maybe to get a second opinion, maybe hop on a plane and fly to Johns Hopkins and see somebody out of network. Okay, or somebody, you know, there are some people that might seek medical care that isn't covered by any insurance plan. In fact, I had a friend diagnosed with pancreatic cancer who didn't make it, and he was seeking care in Mexico, okay, that was all cash pay. But it gave him hope, and that's his choice. So that's what our plans do. We supplement Christian Sharing Ministries, or we have a new standalone product that it works perfect with cash pay situation.
So first of all, please tell Philadelphia American that I have no intent to collect on any of that stuff.
Yeah.
But anyway,
Nor do I.
yeah. But anyway, we brought up catastrophic care. So what is catastrophic care?
Catastrophic care is the stuff that you really need insurance for. Yes, there are big bills. There's heart attack, cancer, stroke, renal failure, ALS, and on and on.
Broken leg.
Well, broken leg may or may not be catastrophic,
okay.
You know. But catastrophic typically are the things that can put a real dent in your weekend financially. As you know, I broke my tibial plateau ice skating,
yeah.
Okay? And, you know, and I Ubered to UPMC Mercy, and I have that enhanced accident benefit that you do. So in an emergent situation, you're not going to shop. And so I was at the mercy of the system. And my plan completely mitigated that risk. I had zero out of pocket for that very expensive emergency room. But from there on in, everything was a shoppable event, okay? And so I wouldn't consider most breaks catastrophic. There may be exceptions to that, a broken back, paralysis, things of that nature, fractured hips. She's the doc. But you know, a catastrophic event is something that the average person cannot write a check for. That's what you need insurance for.
I agree.
Yeah.
You know, and with my own experience, I ended up in the emergency room for some emergency surgery, and I didn't shop. I went right to Allegheny General, and they took me right into surgery, and your system worked.
Yeah, it did.
You know, I was responsible for that $5,000 deductible, and every other penny was covered.
Everything.
So my personal experience is the system works when it's done right.
Yeah.
And it wasn't hard for you to meet the $5,000 deductible because you saved that $17,000 that you were paying previously on a inflated premium.
Well, that made it easier, but it was still tough. No.
Well, sure.
But
No.
the other thing I want to check in there is when I talk to consumers, you know, if we were sitting down at the table and we were saving you $17,000 a year, I'm going to remind them that this isn't just $17,000 in savings. If my client's 55, there's a high probability that he or she's going to be paying that for the next 10 years. So they may be saving $170,000.
Right.
So it could be a $200,000 transaction by changing their behavior. Now think about that. Visualize $100,000 or $200,000 chunk of cash on the table and ask yourself this question: Do you want to send that to the big box insurance system where you're going to get inferior care, prices are probably going to go up, or do you want that in your cookie jar?
Yeah, well, the answer to that is we want it in our cookie jar.
Absolutely, because it gives you choice.
Absolutely. So do you see this direct care growing?
Oh yeah. So if you look, there's a website called dpcfrontier.com, and that gives us a mapper of all the direct primary care practices in the United States. And so if you looked at DPC Frontier back in 2010, there were about 100 known DPC practices. Now there are about 1,100. So the growth of this model is really, moving forward. Absolutely.
And it's through education, through getting out on shows such as Healthy Pets, Healthy Owners, Healthy Pets, Healthy People on the radio. The word is getting out, and people are realizing there is a better alternative.
There is an alternative, and it is a better alternative, yeah. And not only do we see DPC, direct primary physicians, such as Dr. Lynn, growing, there's another trend that's growing where you have same-day surgery centers. And I want to put a plug in for the Surgery Center of Oklahoma, for example, where you can go to their website, and every procedure, first of all, it's bundled pricing, which means if you have a knee replacement or whatever, their price includes facility fee, surgeon, assisting surgeon, anesthesiology, radiology, pathology. It's cash pay, and you're going to find that it is about a third of what the big box hospital right across the street would charge for the same procedure. And in often cases, it's the same surgeons doing the work. So the consumer's winning in that arena as well. Another phenomenon, to plug another friend, Dr. Kirsten Dickerson, she started an imaging center called Green Imaging, and I see that their footprint's growing all across the country, where people are being educated about CT scans, MRIs, PET scans, things of that nature. And once again, these are cash pay facilities, but when people see the pricing transparently and honestly, going back to the importance of that, you'll find that a $350 CAT scan is about average nationally at Green Imaging. And people look at that and go, my gosh, that's affordable. Why do I need to insure that? And the answer is, you really don't.
So when you say cash pay, you're paying on the spot with a check or a credit card before you have the service and before you walk out of the door.
That is correct.
Just like any other industry.
There's no letters in the mail from all these phantom providers. You know what I mean? Like you pay, it's like going to the restaurant, okay, and it says filet mignon, mashed potatoes, béarnaise sauce, and it's going to be $26.95. You know what you're getting, you pay, you leave, and there's no shenanigans.
As opposed to the a la carte policy of these insurance companies and the way they're billed and the way these bills show up over time. I know after my event, I kept getting these bills, and it's like, when are they going to end? You know, that 6 months later, I get a bill from somebody who read something.
And you'll find that there was recently a study out of the University of Chicago showing that people are delaying care or avoiding care altogether because they're afraid of the surprise bills. And we all know that when that happens, whatever problem they have gets worse and worse and worse and worse until they end up in the emergency room with a very expensive problem. So we need to make the prices transparent, and that's what really needs to change in the system.
So that word transparency, we hear that used a lot. We don't often see it. But what does that actually mean as far as a cost of a service?
Well, her model is a beautiful example. If I were a subscriber to Family Matters, I know what I'm paying monthly for access to Dr. Kirsten Lynn. If I needed blood draws, testing, diagnostic procedures, she would say, Tom, I can get this. You go here, and it's going to cost you X. You'll know what it's going to be. And it's the same thing with surgery. It's the same thing with imaging. The consumer's empowered with knowledge.
So if I'm not a patient of Dr. Lynn's and I'm just going to a lab to get a test that my physician ordered, how does transparency work there?
Certainly. Allow me to say this, and kudos to the present administration in Washington, D.C., because an executive order was signed this year kind of mandating or promoting price transparency. Now, not all hospitals are complying with it. But kudos to example, a consumer watching this show, I encourage them to go online, Google Ohio Valley Hospital price transparency, and it'll bring up a 2-page report showing the cash pay price for their most common tests, preventive care, minor surgeries, things of that nature. And the prices, I think they're better through Dr. Lynn, but they're significantly less than what consumers would pay if they ran it through their insurance. And when I show customers that, they're shocked. Like I said, it's hard to convince people that they can get it for this when in fact they've been scammed for that. But price transparency, one of the things that Keith Smith did and the Oklahoma Surgery Center has done by posting their low rates for bundled pricing, it's also shaming competitors into what a market does. I mean, if you're charging $7,000 for the same procedure that I can get for $750, what is happening now, competition is bringing prices more in line. You're having providers and surgical centers and hospitals beginning to compete where heretofore, because they've run more of a cartel where they have price secrecy and fixed deals behind closed doors that they consider to be intellectual property that the consumer doesn't know about. We don't have a free market, but as things are trending in this direction, the consumer's going to win because they're going to have more choices and lower out-of-pocket costs.
And better care.
Better care.
And that's really the bottom line. We want better care.
Right,
Yes.
and you deserve better care. We've gone for way too long in this country accepting minimal care. So this price transparency and this free market medicine is finally bringing back that higher value, higher quality care.
And there's no way any medical provider that sees somebody 5 minutes twice a year understands your health conditions.
Right.
Or
I mean,
concerns.
what do you really get out of that? Maybe a form is filled out for your driver's license or something like that. But what are you as a patient really getting out of it? Are you learning how to be more healthy, how to take charge of your health, how to get off of medications? No, because there's just not enough time in that system.
So it behooves everybody out there to become proactive in every aspect of health care.
Right.
From health insurance to direct care, this understanding actually benefits them every which way that you can think about.
Certainly.
You are correct.
It helps provide someone health
Right.
and wellness.
Yeah.
Right.
People are stressed out. There's a lot of folks that are burdened by paying, like your premium or the average major medical premium. I took a glimpse at a big box insurance company's rates for 2020. Typical plan designs. Some of these premiums look like mortgage payments, okay? And the stress financially of that. And then these people are herded into this traditional system where the doctor's stressed out. The doctor's seeing 25 people a day, giving them very little time so they're paying the most and often getting the least. What our model is doing, I'm taking some of that financial burden off of them, in fact, thousands of dollars, which can relieve them of stress. We're educating them about providers like Dr. Lynn who are offering a better service at a lower rate, taking more time to care for that consumer. I mean, people are winning. It is win, win, win.
Sounds that way. So, Dr. Lynn, your patients provide a monthly fee that you're charging. They're billed monthly?
Yes, they're billed monthly, however they prefer to pay, credit card. And now, because of that same executive order, we're able to accept HSA funds for the monthly subscription fees. So again, that's another win for patients.
Unbelievable that what you two are doing to reform healthcare, I guess is the best way to say it. We're at the end of our show. That was a quick show for us here today. I want to remind everybody, both Mr. Yakopin and Dr. Lynn are going to be on Healthy Pets, Healthy People on October 19th. That's at 9 o'clock in the morning on a Saturday, giving you the opportunity to actually call in and ask these two wonderful people here questions that can directly impact your life and your wellness and your health. Thank you both so much for coming on.
Thank you so
taking
much
the
for
time out.
having
My
me.
pleasure, sir.
Remember, a healthy pet is a happy pet. And when you're healthy, you're happy as well. You need to work. It's a job to do that. We'll talk to you next time on Healthy Pets, Healthy Owners. Thank you, everybody.